As you begin your medical school journey, it's normal to have countless questions about what happens next. Today, let's focus on two big questions. Why choose primary care? And why choose Geisinger? Listen to the voices of Geisinger doctors, residents, and medical students as they talk about the myriad of ways primary care provides both a fulfilling and stimulating career.
Primary care is really the front line of healthcare and where you get to see the most patients and make the greatest impact.
You come to be the source of truth for them. It's really a good feeling.
You get to follow the progress of the same patient over many, many years. And that was just always extremely appealing to me.
The patients learn to trust us. We become like part of their family.
If you truly want to transform healthcare, become a primary care provider.
Primary care is critical to transforming healthcare from disease management to care for the total health of patients. This is how we improve the health of entire populations, one patient at a time.
It has been estimated that if there is one, and let me repeat that, one additional primary care provider per 10,000 patients, the number of ED visits would decrease by 11%, the number of hospitalizations by 5%, and the number of surgeries by 7%. So the relative risk reduction of premature death decreases by 19% in patients who have primary care physicians. This is not a trivial reduction.
I think that Geisinger understands the role of the primary care physician in 21st century medicine. One of the things that we know is that healthcare in the United States is the most expensive in the world. Some of that is because there is a lot of unnecessary care being provided. I think that when primary care physicians are able to do more and more and contribute more and more to your care, the care is going to become more efficient, and efficient care is always the highest quality, and it's the least expensive.
So I strongly believe that in order to take care of our communities, we need to take care of them at a very basic level. We need to understand their community, we need to understand their living arrangements, we need to understand their socioeconomic status.
The foundation of this specialty was really about recognizing behavioral health, individual health, community health are all a piece of the puzzle, and we need to address all if we're going to get to the types of health outcomes we all say we desire.
Primary care is all about developing deep, intimate bonds with patients. No other area of medicine allows for such incredibly long-term relationships.
Open communication is something that I really value in the patient-physician relationship, and I think primary care allows you to create such a meaningful relationship with your patients over several years and even generations of families. That really helps establish that kind of trust.
I've been privileged to be invited to the wedding of one of my elderly patients. I've been at a 100-year-old birthday party for one of my patients. So there's a lot of joy.
I feel like I've done a good day's work when I go home and feel like I have treated the patient like I would want my family members to be treated. And that's always my goal. I think, what would my sister, what would my mom, my dad want? And I treat those patients like they are my family. And that's why my job is so impactful.
You are your patient's doctor. Even when you refer your patient to a specialist, invariably they will say to that physician, "I have to discuss this with my doctor." A primary care doctor must master a breathtakingly broad expanse of knowledge. You really do have to know it all.
I think that the primary care physician has to be able to deal with more abnormalities than really any other specialty. We need to be able to detect abnormalities in so many different systems, be able to treat about 80% of them on our own.
A typical day for me would be seeing many patients with chronic disease such as diabetes, hypertension, COPD, but then on the other spectrum, I may see a young patient, a baby, and giving those immunizations to prevent any kind of medical diseases in the patient, as well as preventive health. So ordering mammograms, colonoscopies, bone densities, everything we can do to keep the patient healthy.
If you're interested in primary care, internal medicine and pediatrics is a fantastic way to do it because you get really rigorous training of an internal medicine residency and a pediatrics residency, so you get a lot of the inpatient experience like ICUs and floors, but you also get all of the ambulatory experiences in clinics. So you really in-depth know kids and adults and can apply that to your knowledge as a primary care provider.
It's a satisfying career, And at Geisinger, the opportunities to advance and grow your career are plentiful.
Clinical work remains the mainstay of what most people come to Geisinger to do, but there are numerous pathways. There's the educational pathway. There are colleagues of mine who are program directors, associate program directors, fellowship directors, core faculty. One also has the opportunity to do research, which I've continued to do, both clinical and basic science related research. And there are colleagues of mine who are involved in extremely high caliber research, which makes them nationally and internationally known. I would go on to say that the opportunities that Geisinger provides is second to none.
If there's an opportunity that you want that exists, they find a way to connect you with them. Or if it's something that doesn't exist, they put you in touch with people on how to build it.
I'm really excited about the research opportunities that they have set aside for the primary care scholars in the Abigail Geisinger program. And so I'm really excited to hopefully get involved with diabetes research this summer.
So why choose Geisinger? We can sum it up with 4 T's: teams, technology, tools, and time.
We have pharmacists who help co-manage conditions such as diabetes and depression. We have nurse navigators who follow up on patients who have been admitted or have gone to the ED. We have our triage nurses who will field calls and get patients in the same day if need be.
From the moment I walk in the door and I have a biller embedded right in my office, to my nurses who will order immunizations, blood work, preventive screening such as mammograms, bone densities. I go in the room and there's a lot already done for me, so it's very much a team effort.
The reason why telemedicine is important is because it makes care possible to people who would not have had care or for whom care would have been a major inconvenience. MyCode looks at the differences genetically between 2 people who appear to be similar. So 2 people of the same age, the same build, the same race, the same ethnic characteristics may have subtle differences that may make a medicine more effective in one than the other, may make one more susceptible to a particular disease or condition than the other. And I think that as time goes by, we're going to have therapy that's much more pinpointed towards that individual based on what we know about their genetic makeup. I think that Geisinger really has a head start on that, and I think that that's one of the ways that primary care physicians are also going to be able to use great cutting-edge technology to take care of their patients.
Geisinger recognized that to take care of complex patients, one needs more time to take care of them, and therefore extended the duration of a visit for patients over the age of 65. Not only were we taking better care of the patients, but we were improving quality metrics, which is extremely important. And we were reducing ED visits and hospitalizations.
Knowledgeable and compassionate primary care providers are the answer to the high cost of U.S. healthcare. Our vision for the primary care of the future is care that increases overall quality while driving down the cost, making healthcare more affordable to more people. We are inviting you to achieve that vision while your tuition is paid and you enjoy a monthly stipend.
I don't know of anyone who's put this kind of financial resources into an effort to train more individuals who are open and generous with their time and expert knowledge and are really wanting to move into communities and create authentic healing relationships.
The school itself is very warm and welcoming, and they really foster you discovering what you want to be and what your career kind of wants to be and where you want to go. So it's lots of opportunity even in campus selection that you could end up in all different places depending on what your interests are, which is really nice.